Hi, I'm Randy Alvarez. You're watching the Randy Alvarez Business Report. Today we're talking to plastic surgeons, dermatologists, cosmetic surgeons about AquaShape liposuction and does it work and what are some of the advantages over traditional lipo. With us we have board certified plastic surgeon, Dr. Jeffrey Dittesheim. Dr. Dittesheim, welcome to the program.
Thanks.
Okay, so there's a lot of people, and you're a huge fan of AquaShape liposuction, and they're not paying you for this piece, we should mention that. Why is it better than traditional lipo? And what do you want doctors to know? Because, I mean, you're publishing papers about it, things like that. So why is it better?
So, Randy, first of all, I have been using AquaShape liposuction for 5.5 years. I looked at it at my own expense and my own interest in trying to find something that was better than what I was using before. Mm-hmm. I've used power liposuction, I've used ultrasonic, I've used laser, pretty much all the different techniques that are out there. And this is different. It's different because it seems to be gentler to the body. I don't see the kind of recovery, the kind of swelling and bruising that I saw before. And because of the technique of the cannulas, the cannulas that I use, they're small, they're delicate, that it allows me to do more sculpting in different areas of fatty tissue, more superficial to the skin, closer to the surface than I could do before with bigger cannulas. So technically what that means is that, yeah, it might take a little bit longer. And that was one of the big complaints that doctors had was, oh, this is going to take longer. It does take a little bit longer.
Like
when
what? I mean, put it in perspective, 20% longer?
In my first 100 cases, it took me maybe 50% longer. Since then, and that's 3 years ago, it doesn't take me longer, and I've studied that.
Well, give me that time. So abs, flanks,
so let's say you do
you?
Tummy and hips, tummy love handles, hour and a half.
Okay.
But it's a sculpting technique more than what I was getting from the other techniques, and I can control what is happening and where the fat's coming out so that the results really are more predictable. The other big difference is that in all types of liposuction, you have to blow the tissues up like a sponge, inflating a sponge with water. And that's called tumescent liposuction. That's what all doctors do. Here, we're not doing that. We're not distorting what the area looks like. And think about it. You have a lower tummy and now you put twice as much fluid in. You can't tell what it's going to look like at the end. Here, there's a different way to do that so that what you get at the end is what you're going to see. So nice. I can tell right away. So when someone goes home, they know what they're going to get. And I could never do regular liposuction, traditional liposuction, under local anesthesia, which means that I'm numbing the area. So it is really realistic for patients, and I've done this in hundreds of patients, where they can come in, they drive themselves in, I numb up the area, I treat them, I see what they're going to get. They stand up from the operating table, they stand up, they put their garment on, and they can drive themselves home. Now, I could never do that before.
But you're getting smoother results, by the way? I mean, less bumpy results?
I don't see any, I do not see.
So you see smooth results?
I see smooth results.
Because I've seen your photos. I mean, they are smooth.
And I see things that I didn't see before. Now, it's not true for everybody, but I see this consistently. I see smooth results. I see skin contraction in areas that we didn't see the skin contract before. And one of the other great benefits is that in addition to the sculpting benefit, I can use the fat for fat grafting for restoring face, hands, breasts, buttocks, and the quality of the fat appears to be very good. So in this age where we're trying to restore what's been lost with aging or wanting to reshape the body, I'm very frequently using the fat, instead of throwing it away, using the fat to restore shape to the body.
But why is the water lipo giving you a better quality of fat that you can use over traditional tumescent liposuction?
Yeah, this is something that's really actively being studied right now. But the early results show that it may be that there's a great study that was just published in the Plastic Surgery Journal that showed that it may be that the way that the fat is delivered, what's coming out of the body, is not the same with all different harvesting techniques. So, and this is going to require a lot more investigation than what we have in 2015, but we want to be able to use fat in different places and have the fat live and stay there. So if So what we know is that the fat, and I can tell you from my experience in hundreds of patients, that the fat that I'm grafting is good fat. And I can tell you, for example, with laser liposuction, you can't use that fat. That fat is not living fat. So we want something that can be efficient for the surgeon, something that can produce an artistic result, a controllable result, something that's predictable so the patient comes back the next morning and can see the result right away. And we want something where the patient doesn't have long downtime. So rather than having a non-invasive technique where you might freeze the fat or inject something, right? You don't know what kind of result you're going to get. Here you can get a predictable result. That's what people want, and it makes sense. So in 4.5 years, and I have studied this, incidentally, in over 300 patients, consecutive patients in my practice, over 4 years. And I can tell you what the results, and this is what's going to be published, that this is different, and for me, it produces better results than what I saw before.